Like many other places in the world, we have to bring back restrictions. I can tell you that I follow the data for each region very closely. Our challenge is to find a balance between mental and physical health. There's no magic recipe to succeed against the pandemic. We're having discussions with public health to find the best solution, but at the end of the day, I'm the one who make the decisions, and I take full responsibility. That being said, we continue to see significant increases of cases in three regions: Capitale-Nationale, Chaudière-Appalaches, and Outaouais. That's why I'm announcing that emergency measures in Quebec, Lévis, Beauce, and Gatineau will continue until April 18. In Montreal and Laval, the level of contagion is very high, and we expect it to accelerate even more. So as a precaution, I'm announcing that the curfew in Montreal and Laval will now be at 8 p.m. starting next Sunday. At the moment, we're keeping the schools open. We're also monitoring the region of Estrie very closely. If the increase continue there, we may have to turn the region in red zone. In Montérégie, Laurentides, and Lanaudière, the situation is stable, but we continue to follow the situation very closely. Meanwhile, we're continuing the vaccination. I would like to thank the teams leading this historic operation, and I ask you to get vaccinated as soon as it's your turn. The virus is present everywhere, and the variant is more contagious. I ask you to reduce your contacts as much as possible. I know it's difficult, but it's the only way to stop this third wave. Thank you.
Hi, everyone. My first question is two parts. First, can you clarify until when the 8 p.m. curfew is expected to be in place? And also, why are we settling right now for an 8 p.m. curfew? Would it not make sense to be more proactive in Montreal and Laval, considering that the situation is not improving in certain regions?
But first, the curfew at 8 p.m. will be until further notice, so we don't put a final date. Second, we are still surprised to see that there's no explosion of cases in Montreal and Laval. So we can expect that it will happen eventually. So that's why we put this preventive measure with the new curfew. But we have to adjust our measures, taking into consideration the actual situation.
And secondly, I know the list for vaccination priority was updated today, specifically for people with chronic illnesses. The list, though, is very specific in terms of what kind of chronic illnesses qualify, what kind of treatment they should be getting. So the people that are not on that list, who have chronic illnesses, will they be vaccinated alongside the general public? And if so, how do you justify that?
In fact, they will be the best place to be vaccinated will be in the pharmacies, because they have the list of the diseases and they can evaluate the chronic disease. So I would say that's probably the place. If you have a chronic disease, you go to your pharmacy and then they're going to be evaluating. As we told, the very, very high-level critical chronic disease that are going to be made in hospitals, because they need to get care in hospitals. But for the other ones, the people who had high blood pressure, diabetes, and everything, that's going to be in pharmacies. It's going to be a best way to make sure that you will receive the vaccine, and the pharmacists have received those lists and even can find in their clientele who's the kind of person who needs to be vaccinated.
So to clarify, the people who will be vaccinated in hospital are the ones specifically on the list, and then other people who also have the chronic illnesses can still at the same time book their own appointments at pharmacies?
Yes. In fact, I'm telling you that imagine you go to kidney filtration hemodialysis every 3 days. Those persons are going to be vaccinated in hospitals because they get care there. But if you're a diabetic, high blood pressure, chronic heart disease, your pharmacist can take care of you and will have doses for you.
Can I just add one thing on this? This is very important. For those people that cannot take the appointment on Click Santé, they just call their pharmacist and he will make the appointment for them. So just to make sure that the pharmacist is aware they can put their appointment in Click Santé, so they don't need to worry about that part if they cannot do it.